Did you know that 1 in 3 people will encounter cancer at some point in their lives? Here's a startling truth that often gets overlooked. Every year, millions of cancer cases are diagnosed far too late, simply because early warning signs were missed. According to the American Cancer Society, identifying cancer at stage 1 can boost survival rates to over 90% for many common types. However, if it's not caught until stage 4, that survival rate can plummet to under 20%. Make sure to watch until the end, as some of these might completely surprise you. These aren't the typical symptoms you've heard about before. Instead, they're quiet, often unnoticed signals your body gives well before the situation becomes critical. But catching them early could mean the difference between an early diagnosis and a late one. We're focusing on scientifically validated warning signs, not unfounded online myths. These are the very signs that have helped thousands of people detect cancer early when treatment is most effective. But paying attention to your body can be the key to catching cancer early. Let's get started. Number 1, unintentional and sudden weight loss, particularly a loss of 10 pounds or more, without changes in diet or exercise routines can be a significant early warning sign of cancer. This kind of weight loss is often one of the first symptoms individuals notice, as it happens without any clear reason. Cancer cells can consume a disproportionate amount of the body's energy, leaving the body with fewer resources for its normal functions. In some cases, tumors produce substances that alter the way the body processes nutrients, disrupting metabolism. This phenomenon is commonly associated with cancers such as those of the stomach, pancreas, esophagus, or lungs. Cancers that affect the gastrointestinal system may impair the body's ability to absorb nutrients, further contributing to weight loss. Because this symptom is subtle and may be mistaken for other health issues or stress, it's crucial to pay attention to unexplained weight loss and consult a healthcare provider promptly. Number 2, persistent fatigue. Fatigue related to cancer is not the usual tiredness one might feel after a busy day or lack of sleep. It is extreme, persistent, and doesn't improve with rest or restorative sleep. This type of fatigue can significantly disrupt daily activities, leaving individuals feeling constantly drained and unable to carry out even basic tasks. It may stem from cancer's impact on the body, such as the production of substances that interfere with normal energy production or the body's struggle to fight off the disease. Cancers like leukemia directly affect blood cells and bone marrow, impairing the body's ability to transport oxygen effectively, which can lead to severe fatigue. Similarly, cancers that cause chronic blood loss, such as colon or stomach cancer, may lead to anemia, a condition that further reduces energy levels. If fatigue persists without a clear cause and significantly affects your life, it's essential to seek medical advice. Number 3, changes in the skin. The skin often provides visible clues about what is happening inside the body, and changes in its appearance can be an early sign of cancer. For instance, new growths, persistent sores, or changes in the color, size, or shape of moles may indicate skin cancer. These changes often occur over weeks or months and may include a mole becoming asymmetrical, having irregular borders, or exhibiting multiple colors. Beyond external skin cancers, systemic issues like jaundice, characterized by yellowing of the skin and eyes, can signal liver or pancreatic cancer. Darkened or reddened patches of skin may also suggest internal cancers. Other symptoms might include itchiness, scaling, or an area of skin that feels unusually warm. Because skin changes are often visible and persistent, they provide an opportunity for early detection. Any unexplained or lasting skin changes should be evaluated by a healthcare provider. Number 4, unusual bleeding or discharge. Bleeding or abnormal discharge from any part of the body can be an alarming symptom and may indicate cancer. Blood in the stool is often a sign of colorectal cancer, while blood in the urine could point to bladder or kidney cancer. Coughing up blood might be an early symptom of lung cancer, particularly in smokers or those exposed to lung irritants. For women, abnormal vaginal bleeding or discharge, especially after menopause or between periods, can be a warning sign of cervical or endometrial cancer. This symptom may also occur in smaller quantities and be mistaken for normal spotting, but any unusual bleeding should prompt a medical evaluation. In some cases, advanced cancers may lead to spontaneous bleeding due to disruptions in blood vessel integrity near the tumor site. While bleeding can have many benign causes, it is a symptom that should never be ignored. 5, lumps or thickening. A noticeable lump or thickened area in soft tissue, such as the breast, testicles, neck, or under the skin, can be a sign of cancer. These lumps are often painless in the early stages, making them easy to overlook. For instance, breast cancer frequently presents as a small, firm lump that may be discovered during a self-exam. Similarly, testicular cancer often manifests as a painless swelling or nodule. Lymph nodes, which are part of the body's immune system, may also swell due to cancers such as lymphoma or leukemia. While not all lumps are cancerous, those that persist, grow, or are accompanied by other symptoms like pain, changes in skin texture, or inflammation warrant further investigation. Early diagnosis of lumps can significantly impact treatment options and outcomes, making it critical to consult a doctor if one is detected. 6. Persistent pain or changes in bodily functions. Pain that persists without a clear explanation can be an early sign of cancer. This pain may be localized, as with bone pain in metastatic cancers, or more generalized, such as abdominal discomfort in cases of stomach or colorectal cancer. Chronic back pain, for example, can sometimes be linked to cancers like ovarian, kidney, or pancreatic cancer. Pain may result from a growing tumor pressing against nerves, bones, or organs. In addition to pain, changes in normal bodily functions can signal underlying problems. For example, persistent constipation, diarrhea, or a change in stool consistency or color might indicate colon cancer. Similarly, difficulty urinating or frequent urination could point to bladder or prostate cancer. Because pain and functional changes can often be mistaken for less serious conditions, it is essential to monitor their duration and severity. If they persist or worsen, professional evaluation is crucial for early detection. To wrap things up, let's quickly recap the 6 early warning signs of cancer that you should never ignore. First, unexplained weight loss can be a major red flag, especially if you're losing weight without trying. Second, persistent fatigue that doesn't go away with rest could indicate something more serious. Third, pay attention to changes in your skin, like new growths, persistent sores, or changes in moles. Fourth, unusual bleeding or discharge, such as blood in your stool, urine, or coughing up blood, should always be checked out. Fifth, lumps or thickened areas in the body that don't go away need immediate attention. And finally, persistent pain or changes in your bodily functions, like bowel or bladder habits, can signal an underlying issue. Remember, these signs don't always mean cancer, but catching potential issues early is crucial. If you notice any of these symptoms, don't wait. Consult your doctor and advocate for your health. Thanks for watching, and don't forget to like, subscribe, and share this video to help spread awareness. Stay healthy, and thanks for tuning in to Overall Health.